In our first community conversation, we're joined by Cathy Reece, manager of the Health and Wellness Center at Sentara Martha Jefferson Hospital. She's sitting down with Aaron.
Thanks for coming in today, Cathy. Good to have you here.
Appreciate you having me. Thank you.
Of course. So today we're talking about a cardiac rehab. So what exactly is that and who is it designed to help?
Cardiac rehab is one of the secondary prevention tools we have to help patients who've got cardiovascular diseases. So essentially people who've had a heart attack, who've had stents or angioplasty, open heart surgery like a bypass, even a valve replacement or repair, a transplant, diagnosis of stable angina or chronic congestive heart failure are the most appropriate patients. Sometimes those are basically what Medicare covers, but some insurers cover additional diagnoses. But these are patients who've had some sort of heart event, and what we're trying to do is prevent further events and teach them how to improve their overall health, reduce readmissions, reduce progression of the disease, and improve their quality of life.
Very nice. And how does exercise play a role in helping patients recover and strengthen their heart health?
Cardiac rehab is a 12-week program that does involve exercise as pretty much the foundation of it. It's also coupled by education though, so the exercise component is typically monitored. Patients wear heart monitors where we can watch for changes in their heart rate, their heart rhythm, their EKG configuration. We can see things that they may not be able to feel or know, let their doctors know. Many times it's to give them confidence that that level of activity is healthy, but the idea is that exercise is not a quick fix. It's the long-term goal. So when they come in and they've been disabled by their disease or they've been set back by their illness, how to progress safely, how to overall improve their exercise tolerance and their activity level so they continue to do it. And then the second part of it is going to be the education. We address lifestyle changes that they can make in nutrition. At Martha Jefferson, we have a program called Pritikin, which is an intensive cardiac rehab program. And each exercise session is accompanied by an education class that will look at nutrition as one of the topics. Heart-healthy nutrition typically means plant-based. Doesn't necessarily mean vegan or vegetarian, but that's also healthy. But a plant-based approach is more like Mediterranean, which many people have heard about. It's a little more allowable, and foods that come from the ground are going to be healthier in terms of anti-inflammation and antioxidants. So that's part of it. We talk about their medications. We talk about what happened to them. We want to empower them with better understanding of what's happened to them so they can advocate for themselves with their healthcare providers and ask the questions that make them accountable to their recommendations. And then we look at the mind-body connection, like what stress does and distress and sleep habits and positivity and why is that so important, and teach them ways to cope so that they hopefully reduce that revolving readmission door.
Absolutely. Great stuff there, Cathy. Thank you so much. Quickly before we go, how can people get in touch with you all if they're interested in cardiac rehab?
Sentara Martha Jefferson Health and Wellness is where I come from. That's our cardiac rehab. Our phone number is 434-654-4502. They can also contact the Sentara website and they'll be referred to us as well.
Very nice. Thank you so much, Cathy, for coming in today.
Thank you. I appreciate the opportunity.
You are very welcome. We'll see you next time. Steve, over to you.